Welcome to Nightlight. Step away from the mainstream and gather around as we enlighten the world and our realities and travel this cosmic journey we call life. Join us as we share with you and provide that beacon that can guide us all to a better way. Explore with us as we examine a metaphysical montage of spiritual insights, covering everything from the mundane to the magical, UFOs to unicorns, and everything in between. This is a time of awakening, of sharing and evolving, of spreading our wings and soaring on the cosmic breath of creation. Come and join with other light-minded spirits as we weave our lights together to seek understanding, enlightenment, and, with a little luck, some wisdom. This is Nightlight, a reminder that you are never alone.
Good evening, everybody. Welcome to Nightlight. We have Ken Quiethawk to thank for that amazing intro. You can find him at Ken Quiethawk, not at nativestorytellers.com. He and his wife have an amazing website. Please check it out. It really is quite phenomenal. Mark has tonight reached into his bag of new, unusual, and wonderfully enlightening topics and brought forward a topic we haven't covered before. So I'm very excited to see how he has researched and woven his way around all of this material. It's a subject that is very near and dear to my heart, actually, and so I'm very excited to see how Mark does with all this material. Mark, I'm so glad you're here tonight.
Oh, I'm looking forward to this. I'm glad I'm here too. Just getting the week started off really well.
Absolutely.
Yeah. We are at a point in I think we're over 9 months now, this Nightlight Part 2. And
yes, we are.
Yeah, that was some bad news to impart. I didn't get fired again. And we aren't going to be.
Are you trying to?
No.
Okay.
No. Yeah. No. This is my job, career mission at the moment, and we aren't going to be discussing Houdini.
Okay.
Okay. This is more like a way of life, I think.
I think so.
But we have. We're going to hear some devastating news about not eating ice cream and bacon, and definitely not bacon ice cream. I know. It's going to be tough on loyal listeners like Brenda and her cousin Mandy, and my human billboard friend and Miss Woo Woo. But our special guest is going to have alternatives like smoothies that we'll talk about later in the show. Yeah, healthcare affects all of us at some point. It's a major political issue. Should America go with a single payer system like most of the Western world? We've given the competition, idea of a competition a chance, but prices keep skyrocketing. We covered that just about 3 weeks ago, and most of our listeners move into the summer, there'll be the bee stings, but have you stocked up on these $600 EpiPens? What about all the expensive medications that have marginal effectiveness? What about all the prescriptions that the doctors wrote that got people hooked on the opioids? So if you're part of the growing number of people who have become disillusioned with some aspects of healthcare, maybe tonight's show will give you some new perspectives on other treatments and cures. Dr. Marianne Teitelbaum has been in a private chiropractic practice for 30 years, and she just recently published her book, Ayruveda Healing the Thyroid, and you can find her book at innertraditions.com, at Amazon, Barnes & Noble, all kinds of other respectable book stores. So I just want to welcome our special guest, Dr. Marianne Teitelbaum.
Thank you for having me.
Oh, yeah, we are really looking forward to this. We don't do a whole lot of medical shows, but we really do want to bring a lot of diversity to our listeners, and I think you have a very interesting book that I thought was very enlightening. I think it's something that needs to be discussed, and I just really enjoyed it. I as we go through the show, there are a lot of topics. I think that our listeners might find to maybe they're having a problem with it, and they might want to call in or join the chat room with a question. Hopefully we can find something to help them with an alternative treatment. So I'm really looking forward to hearing what you have to say. So what is Ayurveda?
Well, Ayurveda, it's a 5,000-year-old tradition of holistic medicine that comes from India. See, in America, we're a fairly new country, and we don't really have an established tradition of holistic medicine. So whenever people decide to seek out alternative medicine, we technically don't have any, and so a lot of the alternative practitioners are resorting to the use of synthetic nutraceuticals like B complex, vitamin C, and so on. And those are kind of like the toxic version of the real thing found in food. And just like their pharmaceutical cousins, they're toxic to the liver and kidneys and have side effects. So this is truly the first book that describes just natural remedies outside of the use of nutraceuticals. Natural means it grew in nature. So this book's using herbs, food, and spices for healing, and none of those nutraceuticals.
Okay. Okay, you've been in practice for 30 years. We'll get into talking about how long you've been working with Ayurveda, but I'm sure that I'm not the only one in the audience who is just learning of this practice. How is it doing? emerging onto the scene here in America?
Well, what I say is that this book is showing two megatrends. One trend is that there's this huge epidemic of thyroid problems, so this book's addressing that. The other trend is that people are very hungry for the knowledge of Ayurveda. There's a keen interest, an intense interest in Ayurveda, but really not only in America, but around the world. It's very big in America right now and growing very rapidly because we don't have an established tradition of holistic medicine. So people are looking at this as something that they could finally use that's, again, using herbs. See, we probably have about 700 herbs. That's what they have in Ayurveda, but we haven't discovered them yet. So they're lying out there in the fields waiting to be discovered, but we don't have a whole pharmacopoeia of herbs to use. So we don't have pharmacies where you can go and, buy different herbs for your different ailments. We've only examined the pharmaceuticals over the past 100 or so years, and now we're looking at these nutraceuticals, and we're seeing they're not so great either. So we need a way out, and Ayurveda is the most ancient of the traditional healing systems. The Chinese came about 2,000 years later because, again, Ayurveda is 5,000 years old. The Chinese came and took their information from the Ayurvedic tradition a couple thousand years later. So these are the truly holistic and traditional methods of healing right now that are just using herbs and things that are grown in nature, the Chinese system and the Ayurvedic system. I always like to go back to the fountainhead and see what the original people had to say. So I studied Ayurveda, so that's what I'm doing. And within the Ayurvedic tradition, the doctors are trained in very advanced pulse diagnosis. In my book, I describe exactly what it is when we feel the pulse. And this is how we can determine what we need to do in each person. It's not the way we feel pulse. Here in America, we feel the rate and the rhythm, like is the heart beating regularly and how many times a minute. That's all we know how to feel in the pulse. But in my book, I have page after page of all the things we can feel. And so in the pulse, you can feel all the organs and glands and the 4 types of toxins, the 7 types of tissues, where those toxins went. For instance, if someone's getting, say, too many flu shots, and that they used to have mercury in the flu shots, they're just now starting to take it out. But for those many years, you could feel the mercury in someone's pulse, and you could see exactly where it went. So it's a very specific system of pulse diagnosis where we can pick up different imbalances in each person and work on reversing them. So it's really a wonderful method of treating patients.
Yeah, that was something, a topic I found really interesting. And I don't know, what you mean is, you just put your left arm on the table and they're doing the blood pressure thing, and the nurse puts her finger or her thumb on your like wrist area, feels your pulse, and that really is about it. And but what's the training you have? Where you're talking about the different other how all the other organs are functioning through that touch. I thought that was really a fascinating subject.
It's a real important thing because the ancient doctors said that the body breaks down in stages. You don't go from being healthy to having a disease like lupus or thyroid disease overnight. And they described these different stages of imbalances that we go through. In the first 2 stages, things could be going out of balance, but you won't notice any symptoms yet. But by the 3rd and 4th stage, if you allow these imbalances to continue, you'll have different symptoms, but you can't name it yet as a disease. By the 5th and 6th stage, now you could start naming it: diabetes, ulcerative colitis. So the goal of medicine should be to see where you are along that path, be able to detect imbalances and then reverse them so that you never make your way to the 5th and 6th stage. In other words, so that you don't ever become diagnosed with a disease. But doctors nowadays, mainstream doctors, are trained to diagnose and treat disease. So they kind of feel that you're either healthy or you have a disease, and there's no in-between stage. So therefore, they're not able to pick up these imbalances with their diagnostic tools. So they can't prevent disease, in other words. They kind of wait till we get the diabetes or the cancer, and then they show us how to just treat the symptoms of those diseases using their pharmaceuticals. So that really isn't the way medicine should be practiced. It's just the model that we know of here in America right now. And that's why people like myself are writing books, to show people that there is a better way to do this. And it's really important when it comes to the thyroid gland, because I would say that thyroid, so many millions and millions of people are walking around with weakness in the thyroid, and they have all the symptoms like hair loss, weight gain, depression, constipation, fatigue, history of miscarriages, irregular menstrual cycles, and on and on. And yet when they have their blood work tested for the thyroid, it looks okay. There's no problem that shows up. But see, we could detect it many years before it would show up in the blood work. So those patients whose blood work is normal, they leave their doctor's office feeling really frustrated and hopeless because they were just told nothing's wrong with them, even though they have this litany of symptoms. So when we see them, we start treatment right away. But what we do isn't just to give herbs for the thyroid gland. We identify and see in each person what's pulling the thyroid gland down, and we fix all those reasons. And so my book has all the reasons why the thyroid might be getting weak. And then we support the thyroid using the thyroid herbs, see. So there's a difference there, not just, pacifying a symptom like that.
Yeah, and I thought one of the refreshing points of your book is you really stress the contrast between the Western medical establishment seeing the body as compartmentalized, and the Ayruveda practice sees the body as a whole. And
that's right.
Yeah, there's just a big a big difference between the two views there. So you're when you're detecting something, just say like the 3rd or 4th stage of a thyroid problem, you're picking up something, and you want to move on it, quickly. And some of the Western doctors are saying, well, there's blood test isn't showing anything, but you really do go for the underlying cause much faster.
Yeah, and we treat the underlying cause. See, there are a group of people who have those thyroid symptoms that I just mentioned, and it does show up as a problem on the blood work that the thyroid isn't working right. So the mistake the doctors make is they give the thyroid hormone, which only serves to weaken the thyroid further, because now the thyroid's no longer called upon to make its hormones. So it goes into kind of like a hibernation. So it's not fixing anything. It's not fixing the reason why the thyroid's weak. And that's one of the big points of my book, is that if you can see in each person, and it's usually a little different in each person, but if you could identify the particular stressors on the thyroid and fix them, And then you support the thyroid gland using herbs, early bedtime, dietary changes. Then the thyroid gland will perk right back up. The doctors are quick to assume that, the thyroid's a problem, here, you have to take medicine now. It's not true. It's just that that's all we've been taught so far. So that's why I just felt compelled to write a book, because you can fix it. Our bodies are fully capable of healing themselves. You just have to know how to do it. You have to know how to nudge them in the right direction, and they perk back up. So that's what I intend to do in the book, and show people all the various influences on the thyroid. And that's why it's called holistic medicine. One of the things, just from treating people in a holistic way, is that when a person has a symptom, the underlying cause of the symptom is usually far removed from where that symptom is. So, for example, if someone has a rash or eczema, psoriasis, whatever it might be called, on the skin, the problem isn't with the skin. It's with the liver and the blood being impure inside. It's just being reflected on the skin. So that's a good example of, there's a skin condition, let's look at the liver, see. Whereas in America, the doctors are trained to look right where the symptom is. You have psoriasis or you have eczema. Here's a cortisone cream to rub on the skin as if it's a skin problem. So that's an example of what holistic medicine means. We're looking at the whole body, see. We're looking at the underlying cause.
Okay, and what does the thyroid do for the body? For for all those who aren't like me, who aren't medical experts, what does the thyroid do? And you do emphasize that it really does play a major role in our health.
Yeah, it's the only gland in the body who has an influence on every single cell in the body. And that's why the thyroid gets weak. In reverse, any stressor anywhere, if it's in the gut, the liver, anywhere, will weaken the thyroid. But the thyroid is responsible especially for metabolism. And so if it gets weak, you could gain weight easily because you're not burning up your food as quickly, see. So, and then once the thyroid gets weak, a lot of things will start to go downhill. It's kind of like a domino effect. So the thyroid helps to keep us warm, so you could have cold hands and feet, see. Or when the thyroid gets weak, I have a whole chapter on this. The gallbladder won't empty well. So I noticed with all the thyroid patients I was treating through the years that whenever the thyroid was weak, automatically the gallbladder wasn't working well. Now, when you eat food, the gallbladder squirts bile, and the bile does a lot of things. One thing is that the foods that you're eating, if there's any fat in there, like olive oil or butter, they're big globules, and they can't just absorb in your cells and used to be burnt for energy. So your gallbladder squirts bile, and within the bile are two detergents that emulsify those fats so that they can break down into very small particles and absorb in your cells. Because the food that you're eating can't help you unless it breaks down into very small particles and crosses a very delicate little cell wall. Then once it's inside the cell, then the body will use it. See, and so it can't use it unless it gets in the cell. So as far as fats go, it's the job of the gallbladder to help the body to metabolize and assimilate and absorb these large fat globules. So if the gallbladder's just sitting there and the bile's not squirting because the thyroid's weak, your cholesterol could go up. So in America, the doctors, when they see cholesterol go up, they give statin drugs, which lower cholesterol. So then people decide that, there's too many side effects. They hear that the statin drugs can give you dementia or problems with your muscles walking or neuropathy because they burn the nerve tissue. So So a lot of people are saying, well, let's go to alternative doctors and let's see what they use to lower cholesterol. And they'll use things like red yeast rice, niacin, and fish oil. But when people come to me, I tell them we're not going to do either approach. Our goal isn't to lower cholesterol, but to fix the reason why it's high in the first place. So that's what I mean. We're not used to, as a country, fixing the reason why things aren't working right. And that's what I'm trying to teach people that we have to do. So if the cholesterol is going up, you have to look at the liver and the gallbladder. You don't just try to bring it down, even with the herbs that could do that. You want to fix the liver or the gallbladder, and in some people it's both. So in the case of the thyroid, when it's weak, the gallbladder can't function properly. So the bile, it's just sitting there and it doesn't squirt out. In my book, I'll talk about the reasons why the bile won't squirt, but it's kind of like when the thyroid gets tired, then the gallbladder becomes lazy. So this bile, which should be like a liquid, becomes very thick, like a sludge. And the same thing, if you let it sit for too many years, that sludge could turn into gallstones, and then you go through those 6 stages of a disease process, and you wind up with gallbladder disease. So in America, doctors just let you go through the stages, and then when you have gallbladder disease, they remove the gallbladder. But in the early years, there was so much that could have been done to thin out the bile. My whole chapter will talk about the herbs, the foods, teas, so many things that could keep that bile thin so that you can, move the bile and squirt it out when you're eating food. Now, the other thing the bile does is it clears out the estrogen out of your body. See, estrogen makes things grow. It's a hormone that women make, their ovaries make, and it makes the breasts grow, the hips grow, and also the lining of the endometrium, which is the uterine lining. It builds up. So if the woman's not pregnant, she sheds that every month in her menstrual cycle. So while we want some growth of the uterine lining or some growth in the body of the hips and the breasts, we don't want too much growth. So the body's very smart. It breaks the estrogen down, which, by the way, is made of cholesterol. So again, it's going to be processed through the bile. So the liver breaks it down, dumps it in the bile for removal out of the body. But when the thyroid's weak, the gallbladder won't empty the bile again, and the estrogen sits there and it reabsorbs back into the physiology, back into the bloodstream. So then what happens? You wind up with a situation of high estrogen and low progesterone, which could cause too much growth, like fibroid tumors in the uterus, or cysts in the breast or the ovaries, or breast cancer, or too much heavy menstrual bleeding, a menstrual cycle that won't go away. It's 8, 9, 10 days, sometimes 30 days long, or just too much bleeding during the period. So the mistake doctors make when they see heavy menstrual bleeding, they put women on the birth control pill, which has lots of very serious side effects, but it's not fixing anything. It looks like the bleeding's getting better because now they have like a normal flow, but it's just breakthrough bleeding that happens when you stop the pill for a week. So in the book I give a recipe if there's too much menstrual flow of some herbs that can recalibrate the ratio between estrogen and progesterone so you're not bleeding so much or making cysts on the breast and ovaries or fibroid tumors. But we also want to keep the bile flowing. And again, I'll show you different ways to do that. But also we have to fix the reason why the thyroid's weak. See, so you have to keep going back and making sure you get to the root of the problem. The other thing that can happen if the gallbladder's not working, you can have constipation because the bile gives you the urge to move the bowels, see, and it propels the food through the intestines. So if the bile's not flowing, the food sits there, you lose the urge to move your bowels, or you might feel like you move a little bit and you can't move more, and then you have to keep going several times in a day to just try to get out a normal bowel movement. Whereas if the bile were flowing properly, you would really empty out in just maybe 1 or 2 sittings. So in America, if someone's constipated, they give them a medication to help them move their bowels. but they're missing the fact that the bile's not flowing. And the final thing that can happen if the bile doesn't flow is that you could wind up with like an acid reflux. They call it GERD. Because when you swallow the food, first it goes into the stomach. There's all this acid in the stomach, churning the food until it becomes like a liquid acid. From the stomach, it squirts into the next place, which is called the duodenum. And the duodenum is like the very beginning of the long journey the food's now going to make through the small intestine, then the large intestine, and then it comes back out. But the duodenum is very interesting. It's like a transition area where the food coming in from the stomach is acid, but it has to leave alkaline, or else you could burn up the digestive tract. So if the bile's not flowing, you'll wind up with too much acid, because once these acids come out of the stomach into the duodenum, a signal sent to the gallbladder to release the bile. And the bile has an alkalinizing effect on the acidic digestive juices coming from the stomach. So the food coming in into the duodenum is acid, but it leaves alkaline, so it doesn't burn up the gut. Plus, again, the bile propels the food downwards, so it moves down until eventually comes out the other end. And it creates like muscular movement in the intestines. So if the bile's not flowing, you could develop something called gastroparesis. It's where you're eating the food, but it just sits there. It's not propelling through the digestive tract. Or even worse, the food could move up, and because it's acidic now and it wasn't neutralized by the bile, you can create like an acid reflux situation. So the mistake doctors make when you have acid refluxing up, they give medications to take away the stomach acid, but they've totally missed the point that the bile's not flowing. See what I'm saying? So now you can wind up with a bad situation, because now you have no acid in the stomach and no bile flow. Not only that, when we swallow the food, there's a lot of bacteria in our environment. It's all microscopic, but everything's kind of teeming with bacteria. So the food we're eating will have bacteria on it, but it's okay, because when it comes into the stomach, our bodies are intelligent. They have all this acid in there to kill any infection that might be in there, so that when it moves into the duodenum, which is, again, the beginning of the small intestines, all the bacteria were killed. So it's very sterile in the duodenum. So if doctors are using these things, they're called proton pump inhibitors. These are antacid medications like Prilosec, Nexium. If they're using those, now your stomach has lost a lot of its acid. When the stomach contents flow through into the duodenum, you can get infection in there, and they call it small intestinal bacterial overgrowth, and the abbreviation for that is SIBO. It used to be one of those things we never heard of, but now it's becoming more and more epidemic as more people take these antacid medications, because they're getting rid of their stomach acids, and now infection can easily grow in the gut. So these were a lot of issues that I felt compelled to write about, because they're being treated incorrectly in mainstream medicine, and so someone needed to write about that.
You just mentioned two or three of those antacid pills. Just I'm sure most of the listeners have seen the commercials for them. So I really like your approach, where you're going back to what's really the cause of, just say, the acid in the stomach, and you're taking an approach where it's more like pulling back the onion, and find keep going back to you get to the core. The core
that's exactly what it's like.
And I just think it's almost like the programming that we're given with all the commercial, just bombarded with commercials. Okay, take the Prilosec. Okay. It's just like a surface treatment, but it's not looking at the real root of the problem. And that's, as you know, I went through your book. You just kept going back to stressing the importance of really finding out what is really causing the problem. It's going to take a little bit more effort and time to find it, but deal with that issue instead of just the concept of just take this pill to just maintain the symptoms. I've heard that a lot recently, but that's really not effective either. It just seems like this modern approach has all kinds of like more drawbacks than healing people.
No, you can't really heal the body using petrochemicals, and that's basically what modern medicine is. You can suppress symptoms, however. I think that the best use of pharmaceuticals, if you ask me, is used for a crisis. Let's say that, you're stressed, your body got too far out of balance, and now you caught a nasty infection and you have pneumonia. Then I would be very grateful to know that this pharmaceutical called antibiotics is there to bail me out. See what I'm saying? But as far as beyond the crisis goes, from what I see with all my thousands and thousands of patients coming into my practice every day, I can't see where it's really getting to the root of problems, and it's not able to prevent any chronic disease. It can suppress the symptoms of them, but it's not really treating any of them. See, this is my first book. I started with the thyroid because that's the biggest epidemic I see, and it's totally being treated incorrectly. But we could sit and talk about any other health problem, and I can show you the mistakes modern medicine's making. So my other books are going to talk about these very common diseases that we're seeing and how to treat them correctly by going to the root of the problem. Again, we're just used to this as a culture, and when the patients come in, I tell them, no, this isn't the correct way to do it. We want to fix the reason why it's happening. For instance, with diabetes, the first thing you think of, again, is the liver, because if the blood sugar is going high, then something's compromising your liver. So we have to see what it is so the patient stops doing that. And then we support the liver so that the liver can bring the blood sugar back down. See, they're just giving medications to lower the blood sugar. See? So, and not only that, they're not only just treating symptoms or suppressing a symptom, but they're not looking at the underlying cause. But I think of each disease as just a symptom. So we could say, for instance, lupus is a symptom of something, or fibromyalgia is a symptom of other things that are out of balance, or whatever you could think of the name of it, ulcerative colitis or headaches. These are all just symptoms, but we just name them as diseases. But what the real truth is that we have to see the underlying, reason for them. So it's a habit that we have to get out of. We have to break the habit. And I'm hoping as I come out with these books, it'll help people to break that habit where we just want to just treat this thing named lupus or treat this thing named cancer, but we want to see why it happened. Like I get so many women in who had breast cancer, and they'll say, yeah, well, that occurred so many years ago. They removed my breast. I took medication for it. I did chemo, radiation. I'm on tamoxifen. And then I'll say, well, why did you get breast cancer? And they'll say, well, I don't know. So I always teach the patients to ask, why do I have this? And if you ask any doctor about any disease, they'll tell you they don't know why. But see, that's because they can't see the underlying imbalances. But we can see easily why people are getting things. And again, it's different in each person. So it's true with the thyroid, but it's true with any other disease. So if nothing else, I hope that this book teaches people that they could have a little weakness in the thyroid, even though their blood work shows that they don't, and how to keep a broader perspective on not only thyroid problems, but really any problem.
Now that you just brought up the sample of some of your patients who said they don't know why they had breast cancer. I mean, the doctors don't have an explanation. You do focus a lot of your research on the causes, and like for let's just say thyroid, since that's what your book is primarily focused on. You do discuss stress and environmental toxins, and that's just a fascinating subject in itself. We can get into like the gasoline-based fertilizers. You have all kinds of like things on statements about makeup. You get contaminated food, like fish swimming in the Fukushima radiation. There's all kinds of garbage in the foods, like the canola oil, gasoline-based food dyes, and things like that. We almost can't escape some of these toxins. How can we decrease some of these toxins in our lives?
Well, what I say in the book is that there are some things you can't control. See, again, anything you just mentioned will weaken the thyroid, whether it's environmental toxins, stressors. So some of these we can't control. Like if we live in a city and there's air pollution, we can't really control that. But there are two things we can control, which gives us a little leeway. The two things we can control are our diet, what we're putting into our mouth, and our bedtime. So in the book, I wrote that the ancient doctors of India said that if you go to bed past 10 o'clock at night, it weakens the thyroid gland a lot and the adrenal glands, because these glands are kind of like helping you get through the day. They give you energy, but then they're like batteries that we run on. So they need some sleep. So if you allow yourself to unwind at night, you'll see that you'll fall asleep early. Just like the birds outside, you don't hear them after the sun goes down. So our bodies are the same way. We were made to be awake when the sun's up and asleep when the sun's down. But because we have artificial lighting, we can stay up if we want. We can stay up very late. So our glands and organs are hoping we go to bed early, and we'll get cues sometimes that we're tired. But it's very easy to decide that you're just going to stay up late, and you can kind of break through that initial fatigue and get a second wind, which means your adrenal glands are going into overdrive now. They're putting out more adrenaline, more cortisol, more epinephrine so that you can stay awake. And the same with the thyroid. It pumps and pumps even though it's tired. So then you can stay up till midnight or 2 a.m., and you could still get 8 hours of sleep. But the next day the glands are going to be exhausted. So one thing you could try to control is to go to bed early, no later than 10, and probably earlier for some people. The other is your diet. So there's a whole chapter in the book that shows what a good diet would be. And I would say most of our patients follow it about 80%. But because there's so many toxins in our environment, we want to minimize the load. Our body can handle some, but when it gets to be that there's too many in the environment and the food's poor and you're going to bed late, it gets to be too many stressors on the body. And then we can start to develop these diseases we were talking about.
Okay. Well, gee, we might as well just keep talking for 15 minutes and then one go to bed.
I know.
Skip.
Well, I know.
May have to make a workman's comp claim if we have to continue doing our usual show from 10 to midnight. But that's right. I'll talk to management about that.
Yeah. Well, actually, when I set up my practice, I was interning with someone who he worked until 10 at night, and I wouldn't get to bed till about 11. And I remember feeling tired all the time. So when I opened my own practice, we stopped working much earlier, like 6 or 7, and I felt much better doing that. So we kind of let people know. In the book, we have a section that talks about the different hours of the day and the best activities to be doing. When's the best time for exercise, and what's the best time to go to bed, like that. Because that's how our bodies are made. So if you know what those natural rhythms of the body are and you follow them, then it kind of stabilizes us so that we don't go so out of balance and get sick. So there's a whole section in the book on that.
Right, and it sounds like you just mentioned Dr. Mishra.
Yes.
And he seems like he had a big influence on you and professional development. You might as well stop and just take a moment to hear about your mentor.
Yeah. So in India, they actually have a few 100,000 of these Ayurvedic practitioners, but sometimes some of them rise to the top. They're called the Raj Vaidya's, R-A-J, and the Vaidya means Ayurvedic doctor from India. They have college there, just like we have medical college, and they go there, and then when they graduate, they become what are called Vaidyas, or doctors of Ayurveda. So my teacher's family lineage, they were always Ayurvedic doctors for 5,000 years back. And they were considered the Raj Vaidyas. That means that they were the doctors to the royalty of India for all those years. So they had this very high knowledge of Ayurveda. So my teacher was sent to America to make formulations for the first premier Ayurvedic herbal company about 20 years ago. And during that time, I was also one of the very beginning Ayurvedic practitioners in the country with one of the largest Ayurvedic practices. So the company actually sent him out to train me, to help me become more advanced in my practice. But at the same time, he could see what was needed in America, what our patients were coming in with, and he would make formulas for them. So as he stayed with me on and off for about those 20 years, he developed about 500 formulas for all the things we were treating, sometimes using very rare herbs to treat things like MS or fibromyalgia or autism. So he had trained me, but he never trained anyone up to the level he had trained me. And I was having phenomenal success in my practice. Like right now, if you called today to make an appointment, we have a waiting list for over 2 months to try to get in. We have people from all around the world and the country trying to get in to our practice because our reputation grew after he trained me and made all those formulas. But what happened was a lot of the doctors said, could you train us the same way you trained her? And he said, what I'll do, I'll make a 2-year course. And in the first year, we'll talk about all the diseases, and in the second year, I'll teach you all the herbs. And so what happened in the middle of the course, he ended up passing away unexpectedly. So all the doctors turned to me and said, is there a way that you could train us? And I said, the only way I can, because my practice is so busy, I can't spend time teaching, but I'll write books. So that was another reason why I wanted to write this book, so I could train even the practitioners how to treat the thyroid gland, because not every single practitioner knows how to do that either. So I was very fortunate to have this opportunity. So throughout the book, I'll talk about some things my teacher taught me.
Right, and since we are dealing with Eastern medicinal approaches to food and herbs, one may have the impression that Ayurveda requires being vegan, but that's really not the case.
No, in fact, Ayurveda was taught, and my teacher also, they are strict vegetarians, and in their textbooks, the ancient doctors said you need something from an animal at every meal. So if you're a vegetarian, that would be milk and milk products. So I have a whole section in my book about milk and what to do if you're sensitive to it, how to fix the sensitivity, the best type of milk to get, how to take it in the correct way, and so on and so on. Because milk is something that we consider a poison in America because it has cholesterol, and we don't really understand its importance. So I go into detail about how important milk is in the diet. But also, this tradition, just because it comes from India, doesn't mean you have to be vegetarian. Not everyone is. I would say more than half of our patients aren't vegetarian. So you don't have to be. But there's certain meats, like red meats, that you would want to be avoiding so you don't clog your arteries. So this book will go into detail about that. But they were very strict on that point, that you do need animal protein. And, in fact, the thyroid hormone is made from animal protein. So I would say that's one of the underlying reasons. If a person is vegan and they're not getting any animal protein, it could potentially weaken their thyroid gland. So you have to keep in mind that a vegan diet, there's never been one in the history of mankind. It's too depleting. At first you might feel pretty good on it because it's a very light diet, but over time your iron count can go low, your protein, your B12, and in the pulse we can feel the health of the 7 tissues. And in the vegans, it's very weak, that their 7 tissues. There's not enough nourishment to them. So at least we teach them, if they want to be vegetarian, how to, have milk correctly. And for milk, you don't have to kill the animal to get the milk. So.
Yeah, and you also do mention, there are other what we call them, like fad diets, like the paleo and the low carb and all these other. They aren't necessarily really good for you in the long run. Like you said, it might help you to feel lighter, for the first couple months, but it's really, some of the diets really aren't beneficial over the long haul.
Well, what's happened, I see it with my patients coming in. The pharmaceuticals that we're using, there's too many of them. America uses more pharmaceuticals than any country in the world. That's why we have so many commercials on TV. This is where the pharmaceutical industry knows it can, get most of its clients from. So these pharmaceuticals, too many antibiotics, birth control pills, steroids, these antacids, a lot of these medications are damaging our digestive tract. The friendly bacteria, which is the foundation of our digestion, the liver overheats from all the acid chemicals going through it. So as a result, when you start tampering with the digestive system, you start to become sensitive to foods. It's not that the food is bad, it's that you're reacting to the food. So the protein and gluten in dairy are the 2 most difficult to digest. And unless your digestion's 100%, your body's not going to be able to digest them. In fact, you'll turn them into kind of like a poison. I'll talk about the Sanskrit name that the ancient doctors gave for that poison. So when you turn your food into poison, you don't feel well. So we'll call that a food sensitivity or a food allergy. But when I was growing up, we didn't have so many pharmaceuticals back then, so many antibiotics. We had 1 or 2 immunizations. Now there's dozens of immunizations that the kids get. And with each round of an immunization, it's wiping out that friendly bacteria, wiping out the liver function. So nowadays, people are very sensitive to food, so then they're creating all these diets around that. You should follow this low FODMAP diet, or maybe this keto diet and take out the grains, or maybe go on gluten-free, or avoid dairy. And so people are avoiding every food group, it seems like. This one doctor says don't have any grains. They have phytates and lectins in them. And another doctor says, well, don't have any animal influence. Be a vegan. Don't have any milk. Don't have grains. Don't have So what's happening is people are pushing themselves into a corner because they can't digest food anymore. And they're making it out to be that the food is the problem, that this gluten is this terrible thing, and that dairy is a poison, and tree nuts, every child's allergic to those nowadays, and they need EpiPens to get through school.
Right.
So, but it's not that the real issue is everyone has taken too many pharmaceuticals. We need to back off, and we need to fix everyone's digestion. So almost every new patient I see is either on a special diet or they have to avoid so many foods because they get symptoms when they eat them. But once I fix their digestion, regrow their friendly bacteria, get the bile flowing out of the gallbladder, fix the liver, then those food sensitivities go away. So in my book, then I say once you're fixed, then in each food group there's certain foods to favor and avoid. But you don't want to give up a whole food group. So with milk, I show the best types of milk to take, or the best grains to favor, the best grains to avoid, like that. So that's the real issue, is what's happening to our digestive system, not that these foods are all really bad. And we should create diets around the fact that we can't digest things anymore.
Yeah, and Dr. Teitelbaum, you wanted to bring up the Sanskrit name for poison.
Mhm. The Sanskrit name for poison is Visha. So one poison we make when our digestive system isn't working, like I just described, they call it Ama Visha. Ama means the food you ate now is just sitting in the channel. It's just clogging it. It's sitting in the digestive tract. And because your body's digestive system has been compromised, it can't break the food down, and it sits there in the digestive system. It's not absorbing in the cells, and it rots and ferments over time, and it forms this poison. There's another type of poison called Garvisha. Garvisha means from the outside world, like pesticides, heavy metals, air pollution. Pharmaceuticals would be in that category. That's kind of a poison, even though it might have some influence on the body. And also nutraceuticals, these synthetic vitamins, B complex and all those things that are also made in a lab. They would be considered something foreign to the body and toxic to the liver and kidneys. So that's the Sanskrit word. It's called Visha.
Okay, and what about the people who do a lot of fasting or just eating one meal a day? Is that really good to have such a small intake of food, or would you think that there should be like smaller meals done throughout the day? I was just wondering about that.
Well, I used to sit while my teacher and I would see patients, and I would take the notes for the patient, depending on what my teacher was saying. And one of the notes I kept writing over and over and over and over for all those 20 years was, never skip or delay meals. And the reason is that in the body we have what's called a digestive fire. So when the food comes in, you have to actually burn it up, literally. You have to cook the food. So that's up to the digestive organs to do that, the stomach, the acids, the bile, the enzymes. So the food coming in is being burnt up. See, so this the stomach, the ancient doctor said, has one digestive fire, but the liver has 5. The liver is one of the larger organs in the body, actually the second largest next to the skin, and it has 5 flames to burn up the food, so it's this very hot organ. So if the food's not coming in, like you skip breakfast, or maybe you skip lunch, or you delay lunch too long, then the liver will overheat, and it keeps overheating, and it's looking for food. And then they say that those digestive fires now, there's nothing for them to work on. So the heat from the liver spills into the whole body, and it becomes a big source of inflammation, which could also start to trigger more autoimmune. So I'll talk about that issue in the book. But fasting isn't something I've ever taken a patient through. And even though I've been in practice for 30 years and I've seen 90,000 patient visits, it isn't something I've ever done with a patient because of that reason. You don't want to overheat the liver.
Okay, and you know, since you just started talking about the liver overheating, the ancient practitioners really did place a lot of importance on the liver, which that was a new awakening for me. But can you tell us how the importance of the liver in the Ayruveda techniques?
Well, the ancient doctors considered the liver the most important organ in the body because the liver keeps the blood clean for the brain. So the brain's very important, but also the liver has over 500 functions. And I am pretty sure from what I see in my practice every day that almost every disease we could trace it back to some malfunction in the liver because, again, the liver controls the blood sugar. So if your blood sugar is starting to creep up and they say you have prediabetes, that means you don't quite have it yet, but over the years the blood sugar is creeping up. Something's wrong with the liver, and we need to look at that. Or any skin condition you could think of, the liver keeps the blood clean. So the skin's an organ of elimination. It's eliminating toxins. So if the liver becomes impure, and then it's filtering the blood becomes impure, and then lots of toxins come through the skin. So any skin condition you could think of, from eczema to seborrhea to psoriasis to, just about anything, acne, it means there's something going on with the liver. The liver controls the cholesterol, like I was saying before. So if the cholesterol's going up, you have to look at the liver. All the autoimmune diseases, if the liver overheats, it pushes the immune system off balance to the point where it can attack the body. That's called autoimmune. All these food allergies we're seeing coming from the liver heating up. So we could go on and on talking about almost every disease is caused by malfunction in the liver. So in my book, I teach you how to take very good care of the liver. Everything we swallow goes through the liver. So we have to keep the liver functioning smoothly and happily so that it can remain intelligent and not make those mistakes where the cholesterol will go up or the blood sugar or autoimmune or something like that. It's really not hard to do, and I think that most people that I've talked to who've read the book said it was easy to understand and that it makes real good sense. And they were kind of surprised to see that every one of these diseases does have some root problem, and a lot of it does come from the liver. Maybe not everything, but a lot of it. So we need to take a very good look at our liver and make sure we don't abuse it.
No, I agree with those reviews too. You just present it. Your information in an easy to understand way for just a lay person like me. It's set up very well, and just walk the reader through the concepts you want to develop, and you do break up the very informative sections with like the sarsaparilla tea recipes for some of my friends who I mentioned at the beginning. So you might want to take a second there to talk about other things that you include besides just talking about the sphincter of Odin and the thyroid, kind of like boring topics like that. But as we get into the summer season, we need to have some exciting new recipes that you do introduce, and you have like this sarsaparilla tea and the sesame almond smoothies. So let's talk about where you got these recipes, what they do, and how they break up the information, like a little bit harder core information in your book with these probably new ideas to a lot of the listeners. Hopefully over the summer months, people will enjoy some of these kind of smoothies.
Yeah, one of the things is that there's three basic components to our health. First thing is we need to see what's out of balance and work on fixing those things. So my book talks about things that could throw you out of balance. The second thing is the diet. We need to address that. And the third thing is we need to address cleansing. So a lot of the recipes I was giving were recipes for cleansing because, again, we don't do it where we're fasting, but we do it where we're either eating food that's detoxifying in nature or maybe making teas. So in the book I talk about the fact that there's 4 types of toxins that can come into the body and then the best way to remove them. The thing is, in the winter months, the channels, we call them channels in Ayurveda, in the body, from the time you swallow food, it travels through the digestive tract, which is like a long channel. Then it's absorbed into the bloodstream, and it goes through those channels, like arteries, veins, vessels. And then it becomes things like urine, sweat, tears, toxins, lymphatic fluids. They're all traveling through thousands of little microchannels before they exit the body in the bowel movement, urine, and the sweat, always through physical channels. So with all these thousands of channels, what happens in the winter months, they shrink up from the cold because cold has that tendency to shrink and contract. So a lot of toxins can't get out in the winter. That's why we don't talk in terms of a winter cleanse, but instead we talk about spring cleansing. And that's because in the spring, like right now, when the temperatures start to warm up, the channels will dilate. So there's a backlog of toxins waiting to come out. So this is the best time of year to remove toxins. And then in the fall is another good time. It's like the second best time to initiate any cleansing. So the book talks about how to cleanse. So a lot of the recipes you're talking about were about cleansing.
Mm-hmm. And like for example, with the sarsaparilla tea, you're talking about you might want to drink it like 5 times a week for 6 months.
Mm-hmm.
This process takes a while. For the cleansing, it's different than the traditional. What we're used to, with American type of thinking is, I want a pill, and it's going to just take effect immediately, and that's it. We're done with it.
Yeah, that's how we've been trained. I know.
Yeah, and it's a different. The Ayurveda is a different thought process, but you're saying it's more effective. It's not the side effects. It's not like we keep talking about the really expensive medications or the EpiPens and things like that. You have nice flavors like sesame and oil or almonds. I enjoy those.
Mm-hmm. Oh yeah.
It sounds like, but it just takes a little bit longer to do the cleansing.
Well, everybody's different. It depends on the type of toxins you've stored. One thing I wrote about in the book is that there's two types of toxins. One group are water soluble, and I think when people think they take in something toxic, that it just comes out the next day or maybe in a few days. And that is true with the water-soluble toxins. They'll just come out in the urine, then they're done. But then there are these fat-soluble toxins, which are the very serious chemicals like air pollution, lots of pharmaceuticals like birth control pills. These are very serious toxins that are causing a lot of breast cancer and so forth. So these are fat-soluble toxins, and the fat-soluble toxins can get stored in your fat tissues, and they have to be processed out through the liver. The liver dumps them into the bile. Here's another good example of what happens when the bile doesn't flow. So because, again, the bile is processing fats, the liver dumps these very nasty fat-soluble toxins into the bile. The bile squirts out, and then it comes out in the bowel movement. So if the bile's not flowing, again, those fat-soluble toxins reabsorb. And even if the bile was flowing, these toxins are very hard to get rid of because they go deep. They can go into the bone marrow. That's a fatty tissue there. They can go into your fat tissue, your brain, because the brain's made of cholesterol. So all the fat cells can be storing fat, and they can remain there forever unless you know how to pull them out. So, like, for instance, today I was seeing someone who took birth control pills for 10 years, and she has this skin condition, which is just driving her crazy. She's so itchy from all these chemicals trying to come through the skin. And so she wants to know how long it'll take her to get rid of these toxins. I told her it might take a few years, even with all the cleansing we're doing, because these are fat-soluble toxins, and they're just going to... We have the herbs, and I list them in the book, that get rid of those types of toxins. But any tissue, in the book I talk about 7 tissues, from the blood plasma, the blood, the muscle, fat, nerve, bone, reproductive fluids, bone marrow. Any one of those tissues can be harboring toxins. So we have specific herbs for any one of the specific tissues. So it's more to it than just doing a cleanse that you might have heard about, or doing some sweating or some fasting. It's not quite that easy. You might get rid of some superficial toxins, but not these real deep ones. That's why people who give up smoking 20 years ago, you would think those toxins are out by now. They still get lung cancer. I'm sure we all know someone who gave up smoking 20 years ago and got lung cancer because they're fat-soluble toxins too. They're all sticky, the nicotine, and So, again, we're not a country that understands cleansing at a deep enough level. We've kind of heard some cleanses kind of go around on the internet, but it's really not deep enough for what needs to be done, and not thorough enough.
Yeah, and since we're just talking about detoxing, you do discuss that subject frequently. You do emphasize it should be done slowly, and it should be supervised. Can you tell us a little bit more, because there does seem to be some fads associated with detoxing too?
Well, in the ancient times, again, there's 4 types of toxins. Those 2 poisons I just talked about, the Visha, one is from the food not digesting right. That's an acidic toxin. And then the chemicals from the outside world. That's again why we have acid rain all over in the developed countries from the air pollution. So chemicals coming in create acids, so you'll have acid rain, and in your body there'll be lots of heat in the liver from storing these acid toxins. So in the ancient times, they didn't have these acid toxins. We didn't have acid rain. So back then, the type of toxin we had, they called it ama. And I'll talk about it in the book. Ama just means if the food didn't digest well, and it kind of created like a mucus in the body. And it's a very cold thing. That's why when we have mucus and we say we have a cold, that's why we say it's cold, because ama is a very cold toxin. It won't cause autoimmune diseases and cancer. It's just a byproduct of eating food that was too heavy, like ice cream, or French fries or peanut butter. See, they can't absorb in the cells. They remain stuck in the channel, and they just clog it. That's why we feel a little heavy when we have lots of cheeses or a peanut butter sandwich or red meats. It's just sitting, clogging. It's not really being used into the cells and absorbing in. So this is kind of a big issue. In the ancient times, the toxin was cold, but in modern times, everyone's pulse is very hot. You have a hot liver, the blood's very hot. So from this garvisha, from the outside world, chemicals from outside and inside the body when the food rots and ferments. So because of this overexposure to chemicals in the modern era, these are being stored in the body. They're very hot. So to pull out hot toxins, we can't do things like fasting, which heat up the blood, or too much sweating, or herbs that are burning and heating, like a maple syrup cayenne pepper cleanse. It's called the Master Cleanse. Those cleanses, even in Ayurveda, they were considered heating because we had ama back then, like cold toxins, and you had to burn the toxins out. So that type of information is still in the literature where we want to burn toxins all the time. But in this modern era, the toxins have to come out. We have to keep them cool. So that's what the book talks about, how to cleanse in a way that keeps the liver cool, the blood cool, because heating is going to cause more autoimmune, see? So it's not that hard to understand, but you'll see the way we give cleanses throughout the book, and it's usually through eating food and certain herbs and spices that are cooling in nature.
Okay, and if you go to a lot of the grocery stores now, they might have a little organics section, and you'll probably see these probiotic drinks and other websites advertise them as well. And you do cover the pre and probiotics. Can you tell us a little bit more about those?
I would say almost every new patient I see coming in, with the exception of maybe just one or two every so many years, they're lacking the friendly bacteria in the gut. And that's because most of us have taken medications like antibiotics, birth control pills, steroids, immunizations that wipe out these friendly strains. So in the early years of my practice, I have ways of testing how the strains are doing. They're depleted in every one. And yet they would come in and tell me they're making yogurt, or they buy yogurt from health food stores, or they're taking probiotics. So I got very confused. I didn't know why their friendly bacteria was missing, and they were eating the yogurt and taking the probiotics. After about 8 years of seeing that, I was very fortunate in that I attended a lecture. A doctor came over from Europe, and he brought a very expensive microscope. It cost about, at that time, $60,000, probably be about $250,000 now. And we were able to look at all the probiotic cultures under a microscope, all the companies at that time, and the cultures were dead in every company. There was one company, which I mentioned in the book, where the cultures were alive. And when I contacted the company, they told me that it's very hard to process a probiotic and not kill the cultures during the processing. So when you start with the culture, it's alive. It might have 2 billion, 4 billion, whatever it is, 7 billion live cultures. But as you're processing it, you're killing the culture. So they said unless it says 100% potency guaranteed on the label, then the cultures are probably pretty much died off or just dead altogether. So since I started using that company, everyone's doing much better on it. Great, actually. And people who had overgrowth of yeast in the gut or some other infection, they overcome that very quickly because the friendly bacteria can kill off any infection. We all have a little bit of a yeast in our gut. It's called Candida albicans, and it lives in harmony with us, but our friendly bacteria keeps it in check. So when the strains of friendly bacteria are killed off from an immunization or an antibiotic, that little bit of yeast can multiply as much as it wants, and it fills up in the gut and migrates out of the gut. So almost every new patient I see has an overgrowth of yeast, and it makes them feel tired, and maybe they're distended in their gut. They can't digest right. And so when we give the probiotic, the yeast dies off just from regrowing the friendly bacteria. In other words, you don't have to give anything to kill off the yeast. That would never work. It'll just grow right back. But once you regrow the friendly bacteria, they take care of it. So that's one of the things that the friendly bacteria does, in addition to breaking the food down into small enough particles so you can absorb it into your cells. It prevents infection of not only yeast in the gut, but parasites, fungus. Like if you have toenail fungus, that lets you know that your friendly bacteria are missing in the gut. See, so SIBO, all these different types of infections, strep throat, HPV, you might hear about. These are all coming from lack of friendly bacteria in those specific areas. So, for instance, if you have lack of friendly bacteria in your throat, because the friendly bacteria are from the mouth on down to the rectum, and they're in the bladder and vaginal tract as well. So if you're lacking the friendly bacteria in the throat, you could get strep throat. Or maybe in the stomach, you could get H. pylori. Or in the gut, you could get overgrowth of yeast or parasites. Or in the bladder, you could get bladder infections. And then, so when doctors see infections, they keep treating it with more and more antibiotics. And then you get in a vicious cycle where it kills off more friendly bacteria. Then you get more infections. So you get in this vicious cycle. So I've helped many, many people through the years to break that cycle so that they can manage their own infections. You shouldn't get any infections if you have good friendly bacteria.
Yeah, it's fascinating information, and that's I always hear that after a hospital stay, and you get sent home with some like a week of antibiotics, and here okay, just eat a cup of yogurt a day.
It won't help.
It's and you start making these connections about okay, that's everyone says that just get one of those like little 6-packs of yogurt. Well, it's just a waste of money. It's just people just keep saying the same things, but there's nothing substantial in the food that is going to counteract the all the medications you were sent home with. So that's interesting.
Now, if you make
point
your own
you just
yogurt,
made.
I did talk about the fact that my teacher from India and I, we checked all the yogurt cultures and Whole Foods and health food stores, and the cultures there were dead. So we found that the same company who makes that probiotic that's real active, they make a yogurt starter. So if you make your own yogurt, the cultures will be very alive. So that's beneficial. So in the book, I have a recipe using that yogurt starter. Yeah.
Okay, and we've been talking about different ways of preparing foods and get some of the recipes that you just mentioned, and the probiotic yogurt. We've covered some things to eat, but there are also oils that you mentioned that might need to be applied to babies and infants who can't eat some of these foods at that stage of their lives. And you do talk about some of the transdermal applications that can be done in some cases. Can you tell us a little bit about
Mark,
that practice?
Mark?
Yes.
Mark, we have a caller with a question.
Oh, okay.
Is it okay to bring her on? It's
sure.
Joellen. Hold on.
Hi, Joellen.
Hi. Really interesting topic tonight, and I'm actually wondering if someone's going to, like, I'm going to be going to India this summer, and if there are any clinics that she might recommend, or maybe if I could email later and ask the question as well.
I don't know the doctors in India so well. See, the problem is that in Ayurveda, those books were written several thousand years ago. So they were describing things that had happened then, and they said that we're going to leave the textbooks open for the future doctors to write new chapters because we can't foresee what's going to happen. So they didn't know about, like, all the antibiotics we use and the air pollution we have now, and the fact that we put fluoride in the water and chlorine and it kills the water. So there's a lot of issues that have happened and sprung up now. So in the book I talk about the fact that when I sat with my teacher, he had to figure out a new way to cleanse, a new way to deliver the herbs, because everyone's liver is overheated, so too many oral herbs will heat it up. So he made these transdermal creams. He made these glyceride drops where we put drops in water and you swallow it and it slowly comes into the liver. So this is the adaptation he had to make for Ayurveda for a modern era. So if you go to India, I would say they're not familiar with this upgrade that we've had to make here in the West because they're not as toxic there. They don't use as many pharmaceuticals, although they are catching up to us. Now, when I first met my teacher 20 years ago, he didn't understand what was happening in America. When he started taking my patients' pulses, he was in shock at first because he had never seen this before, where our liver is so compromised that from so many bad foods, we eat a lot of processed foods in America, and on top of that, we've taken lots of pharmaceuticals. So because of that, he had to reformulate, again, all of Ayurveda, how we take the herbs, how we do the cleanses. In this modern era where the cleanses are so high, I kind of am mentioning superficially. You'll see what I mean in the book. So if you go to India, they're going to still be steeped from those ancient texts, which isn't bad knowledge. It just needs to be upgraded from the modern era. So I would say that until they get on the same level that we're at with, like in the cities now, they are having things like McDonald's and processed foods, whereas in the villages where my teacher came from, they didn't have that. So again, he had never taken pulses of people like us where the liver was so toxic. But now in India it's starting to happen. So they're going to have to see and do the same upgrades that my teacher had to do as time goes on, but I don't think it's happened there yet. It's not that you'll get into any trouble there, but I don't know the clinics there or anything, what they're doing. You might stumble on a good one, and then you might stumble on one that's not. So again, my teacher made these changes and they were developed in America, but they're not necessarily understanding them in India just yet.
Would you suggest she read your book before she go?
Yeah, you could do that. Are you going there for treatments, did you say?
Well, I'm actually going for just another visit, just for fun. But I thought, well, while I'm there, I might as well check out a different clinic or just get assessed or whatnot.
You could do that. I mean, there's so many hundreds of thousands of Ayurvedic practitioners. Just the fact that you'll be there, a week or two, you won't get involved with too much of what they're going to have to say, because treating a person Ayurvedically takes months and months. So you won't get too steeped in, what they're going to tell you to do. So it shouldn't be too bad. It's just that they're not used to seeing the American patient, and they might not be as equipped as my teacher was. And it took him a while. It took him about 4 years to figure out what to do to the American patient, because he had never seen this before either. He would give them the herbs, and they would get rashes from them or diarrhea, and he'd have to keep stopping the person's protocol. We would put them on cleanses. They would get worse. And, again, it took him about 4 years to figure out what to do. And once he figured out what to do, then it was smooth sailing. And then he was able to make the 500 remedies. But what my teacher did, it was just a shame he passed away too early, for his work to become so well known. And that's part of what I'm trying to do, is to keep his legacy going, because we need these upgrades for this modern era where the liver's so hot in everyone.
Yeah,
well, thank you so much.
Oh, you're welcome.
Joanne, before you leave us for the call, Dr. Teitelbaum, do you want to give out your website, and that just take a little minute break and make sure that Joellen could jot that down?
Yeah.
If she needs to contact you or
Google
anything.
my name, and my website will pop up. It's Dr. Marianne, Marianne, Teitelbaum, and it's T as in Tom, E-I, and then T again, E-L, B as in boy, A-U-M, as in Mary. So it's Teitelbaum. So my name will come up. Also, you'll see, it'll say there's 10 online classes that I give the patients, but you guys are welcome to listen to those classes if you like. So it can talk about, how my teacher was training me and all these different issues. You'll see the classes. It'll say online classes. If you click on it, you'll see them. They're all named. For instance, there'll be an hour-long lecture on vitamin D and why you shouldn't take it orally. See, the ancient doctors didn't talk about vitamin D and why you shouldn't take it orally, because they didn't have vitamin D back then. See? So same thing when you go to India. They're not familiar with the fact that your vitamin D is low where you live, because you're not out in the sun like they are. Or like here, we get all these flu shots, and the mercury can burn your nerve tissue and give neuropathy. So they're not going to be familiar with that, because they don't get flu shots in India. So in these classes, I'll talk about all these issues. There'll be an hour-long lecture on vaccinations. There'll be an hour-long lecture on magnesium. These are all important issues, but something that wasn't necessarily discussed in those ancient textbooks, because these are new things that come up. So when you go to a doctor and they tell you your vitamin D is low, which everyone's low, then you'll know why you shouldn't take it orally. So those types of issues are talked about in all my classes. So you're welcome to listen to those as well.
Thank you so much.
You're welcome.
All right. Joellen, do you have any other questions for our guest?
No, thank you. I appreciate your time.
Yeah, we appreciate you calling in. It's so nice to have someone inspired enough to call in. I'm glad to see that the show is generating more calls like that.
Mm-hmm.
Thank you. Okay. Dr. Teitelbaum, I think that before the phone call, I was just starting to ask you about like dealing with babies and infants that who might not be able to ingest these herbs for that at that stage of their lives. So the parents might need to put some of the these like transdermal patches or rubbing oil on their spine. How does that work? We're just like looking at absorption through the skin.
Yeah, the skin absorbs. Even modern medicine can give some medications through the skin. We call it transdermally, like nicotine patches or estrogen patches.
Okay.
Yeah.
Mm-hmm.
So we can do the same thing with herbs. My teacher, he wanted to use about 500 herbs, but only about 80 herbs could go through the skin. So we do give about 80 herbs through the skin, but not every herb can go through the skin. So in that case, he developed what are called glyceride drops, where he was able to capture the vibration of the herb and put it in a glyceride that he made out of organic yellow squash. And then we put drops of that into water, and the person sips on it, so it slowly comes into the liver. So for two reasons. One is if the liver's overheated, it would react to the crude herb, and also for babies, you could just put a drop in water, and it's like a homeopathic version of the herb. So, see, every herb has the crude herb, that's the actual plant, but within that plant is the intelligence to perform its activities and its functions. The Chinese call that activity qi, and the people in India call it prana. So it's this intelligence that's inherent in every herb. In my book, I have a whole section on what prana means. So my teacher was able to figure out how to get rid of the crude herb and just leave the intelligence of the herb behind. Again, it's almost like a vibrational way of giving the herbs. He had to do it in this modern era where people need a lot of herbs to bail them out, but the herbs tend to heat the liver, and the liver's already overheated. So this was one of his changes, his upgrades for Ayurveda that he had to make. So we have, a couple hundred of those that we give for, different things. So we can give babies, we could just rub the herb on the skin and it absorbs in, or they could take a little drop of the glyceride drop in some water and sip on that. So, because you can't make teas for babies and expect them to swallow tablets,
Right.
Yeah.
And I was just glad that you have alternatives for babies, and what, and we need to include the elderly. How does Ayurveda work with elderly patients? Might as well just kind of look at both ends of the lifespan.
Yeah, the same way. We could give them transdermal creams, some glyceride drops, so they don't have to swallow so many tablets. Especially in the elderly, they're on so many prescription drugs. Their liver's really overheated. So we have to give the herbs in these other two ways so we don't heat it with more herbs.
Okay. And speaking of these herbs, you do mention boswellia. which is another name for frankincense. And that might be kind of hard to get at your local store. But are some of the other herbs available from the seed catalogs where you can grow them in like a windowsill or in your garden and store them over the winter? Is that possible to do that?
I don't know many patients who do that, but I'm sure you could do some of them. It depends on how hot it needs to be to grow that particular herb. For instance, I tried to grow Tulsi once. It grew really well in the summer. It's a species of basil. And then in the winter months, I brought it into a real sunny kitchen with skylights and lots of windows, and it still died. So it really depends on the herb that you want to grow. But I would say most of our patients don't get involved with growing them all because so many people I see are so sick. I have to put them on lots of different herbs and glyceride drops and transdermal creams and teas that it would be kind of overwhelming for them to try to figure out how to grow these things. But you could also probably purchase a lot of them. You could get anything off Amazon nowadays. So you could at least purchase. And in my book, I have resources for where you could get them. There's different herbal companies now.
Okay, yeah, I just want bring up that topic and as well. It's, a lot of people might like try and grow some things at the house. But,
if they live in warm climates like Florida, they could probably do a lot of them. But not if they live in, say, Connecticut or Alaska or Maine. Probably not too many of them.
Right. I understand. Have you ever been to India?
No, I was fortunate in that my teacher came out and trained me right in my office. So.
Okay. It's just I've never been there. Maybe someday I'll actually make it. But it would. I think it'd be interesting to go there to see, what their gardening techniques are like. How they contrast with America and the different zones. America, the USDA growing zones. It's just a really. It's just a fascinating subject. I've really had a great time talking about this subject tonight. Just lots of neat questions, and I'm just so glad someone like Joellen was inspired enough to call in.
Yeah, hey Mark, I got a question.
Oh, sure.
The way that the government is modifying our food before it comes to the table or to the grocery store, it's really hard to get food that hasn't been fiddled with in some way, shape, or form. How do you work around that with diet and stuff? Because I understand that you any food that's processed is useless, but even the stuff that comes even organically to the stores these days has been treated with so much stuff. How do you avoid that and eat cleanly?
You do the best you can. Luckily, we have enough food co-ops and Whole Foods and places that sell organic. Again, we could start splitting hairs to see exactly how organic they are, but at least it's better, these organic farmers, than the conventional. So, again, you just do the best you can. In my book, I give different sources, for instance, of milk. Milk is one of them. You have to be real careful when you buy it because the cows are fed things they shouldn't be fed, and they should be fed grass and all that. So I'll kind of go through that in the book, but I think that you're, as much as you can, get organic and non-GMO, and you should be okay. Because nowadays there's far more available to you than when I got started with all this in the 1970s. It was just very limited. But now I have so many more options. I would say, if anything, it's a lot easier nowadays.
Well, switching to going totally with the Ayurvedic, it does make it difficult, especially if you are suffering from allergies of any sort that are food related. Especially, lactose intolerance and having to be gluten free and stuff like that. Are those illnesses or allergies something that can be treated Ayurvedically to
they're easy
lessen
to treat.
them?
They're easy to treat. That's what I was saying. We fix the reason why the person's allergic to them, so they can go back to having them. Almost every new patient I see is allergic to something nowadays, from the devastation to the digestive system, the gut, the liver. But once we fix those areas, the food allergies go right away. See, we're not used to thinking that we can fix something. We're used to putting ourselves in the corner. Oh, I can't eat this. I can't eat gluten. I can't eat that. I can't eat dairy. And we're used to suppressing symptoms. That's why we're not getting better. So people are usually shocked to hear that you can actually fix things. You can fix these allergies. You can fix the reason why the blood sugar is going up. You don't have to take medicine to lower it. You can fix the thyroid. You don't have to take the Synthroid. This is a whole novel concept in our country because the doctors don't get it either. But it can be done. I see it every day in my practice.
Okay. We've spoken about detoxing the liver, and one of the subjects that seems like it would be overlooked by a lot of people would be detoxing the bone marrow, and you do cover that subject as well. Can you explain the importance of why we would need to do the detox of bone marrow?
This is an extremely important thing, and in fact, I'm fairly certain this might be the only book that I have read that discusses the bone marrow.
Yes.
So what autoimmune means is that your immune system, which has the intelligence to know to attack viruses, bacteria, pathogens, has now lost its intelligence. It's off the rails, and it's attacking you. That's called autoimmune. If it's attacking food, like we could call it a food sensitivity, like gluten or dairy, or if it's attacking pollen, we could say we have allergies. But the idea is that the immune system's off its tracks. So then in my book I talk about, well, let's fix it, See, again, we don't think we can fix these things. We just think we have to take these biologics to shut off the immune system. But you can fix it. So first you have to know, well, what is the immune system? So a lot of books, before I wrote my book on the thyroid gland, I read all the books that are out there from alternative practitioners because I knew that they were limited in their resources to treat the thyroid. And I wanted to see how they were able to write a whole book on it, because here I have all these herbs and things my teacher taught me. And they were discussing the friendly bacteria. At least they got that far. It's called the gut microbiome. So everybody's talking about it. There's a lot of research. It became very popular in the last 5-10 years, whereas 30 years ago when we were talking about it, people really hadn't heard of it so much. So that part, I have to say, people have got on that bandwagon. They understand it's something we need to address. But then that's where they kind of let everything else go. So this book, we're talking also about the liver and the fact that when the liver overheats, it could push you into autoimmune. And then the third part is the bone marrow, and I haven't seen anyone discuss that. And yet it's the bone marrow where the immune system cells are born. the red blood cells, the white blood cells, the platelets. But nobody seems to talk about it. And the reason we can talk about it is because the bone marrow is one of those 7 tissues we could feel in the pulse. So we could feel many, many pharmaceuticals wind up in the bone marrow. For instance, if you get an immunization like a flu shot, within minutes, those toxins that were in that shot are now sitting in your bone marrow because they're very hot and piercing. Many pharmaceuticals go into the bone marrow. So we're seeing this devastation to the bone marrow, but no one else is. Unless you knew how to take a pulse, you wouldn't know this is occurring. So in the book, I talk about how to clean the bone marrow. It's very interesting. So that's one thing I'm very happy with the book, that I was able to finally get the word out that there is this issue with autoimmune. So for something like Hashimoto's, that's a whole different ballgame than just having hypothyroid, where the thyroid's underactive, or hyperthyroid, where it's a little overactive. But Hashimoto's is where it's not that the thyroid is the problem. The thyroid is the victim of the immune system attacking it. So we have to fix the immune system so it stops its relentless attacks on the thyroid. And the same thing, doctors nowadays, they just give Synthroid or maybe a natural thyroid medication, and they're totally overlooking the fact that the immune system has lost its way and it's attacking the thyroid, and then the thyroid hormones go low. All they're doing is just giving the hormone to make it look good on the blood work, so now the level comes up and you think everything's good. But meanwhile, the immune system's still in there attacking, and if it decides to attack somewhere else, you can get another autoimmune disease. That's why so many people have more than one autoimmune disease, because it goes from one place, and here it attacks the thyroid, causing Hashimoto's or Graves' disease. Then over here, it attacks the colon, causing Crohn's disease or ulcerative colitis. Or maybe over here, it attacks another area. See, so it depends on where it decides to attack as to the name of the disease. But again, it's just a name. So we need to learn about the bone marrow. So once you learn about it, you'll understand why there's such a huge epidemic of Hashimoto's, which was not so common 100 years ago before the onslaught of all these pharmaceuticals we take, which are devastating to our immune systems. But now it's at epidemic levels. It's the most common autoimmune disease in America right now. So I'm really proud of the book that it addresses that for the first time in any thyroid book that was written.
Yeah, it's not like I read a lot of medical information. I was really interested in trying to develop some new information to bring to our audience. You had a really terrific interview with Zoe a couple months ago, and I was like, well, this really is some information that needs to be presented to more people. And I thought that with my limited understanding of reading medical stuff, I could understand it. It appealed to me. It makes sense. It's you really do have a very informative book for someone just like me who would like to know more about Ayurveda and thyroid and topics like that, and just a new approach, because I see a lot of what you're talking about, just maintain symptoms, but we aren't going to really try to make you better or cure, provide a cure. I mean, that means that if you're cured, the money stops.
I've never been that cynical about modern medicine, because I know, being a doctor, doctors want nothing else but to help their patients get well. It's just that they've been taught incorrectly. They've been taught how to suppress symptoms using chemicals, and you can't heal the body using chemicals. It's just all that they've been taught. I think we're on the brink of a major overhaul in modern medicine. People are fed up. Every new patient I see, and again, we have hordes of people coming in my office, they are so fed up with modern medicine, and they feel like they're not getting to the root of the problem. And not only that, the side effects are too severe. They can't even take the medicine half the time. Or like we have people that get a shingle shot and they have severe shingles now. Or they get a flu shot and they're sick in the hospital with the flu. So we're seeing the very beginnings of a shift where people are trending away from modern medicine. More than half the population now are seeking out alternative care. But the point I made in my book is that we're in a country that has no authentic system yet of alternative care. So that's why we have to bring Ayurveda into the country where it's been time tested. What we're doing with these crazy diets that are coming and going, it's not really based in any science yet. Whereas Ayurveda, if you look in my book in the back, you'll see hundreds of research articles where every herb I talk about has been thoroughly researched. Every topic I discuss, like why fish oil is bad for you to take, that's been researched. So every claim I make in the book, I have so many dozens of research articles. In fact, that was the hardest part of the book, was typing all the research in, because there was so much that I had to offer. So we need to incorporate and really study what they're doing in Ayurveda in order to decide that we want to seek out alternative care. Otherwise, we're kind of stuck here. We can't just take all these vitamins. It's just not the way to go.
It's what you've done is much needed, and it's a fresh perspective, and I really appreciate it, and I hope that people go to Inner Traditions or Barnes and Noble, Amazon, and get a copy. Hey, we are down to about 3 minutes, and I want to give you time to promote what you have a couple upcoming appearances where they can see you actually talk about your material, and you can plug your website as well.
If you go on my website, it'll tell you some of the appearances I'll be making. I just finished a West Coast tour where I went to California, Los Angeles, Beverly Hills, and I presented in Vancouver, Canada. Everywhere we went, we had hordes of people showing up and standing room only. Now I'll be doing a talk next Saturday night in Manhattan. It's called Divya's Kitchen. It's an Ayurvedic restaurant that was voted one of the top 100 vegetarian restaurants in the city. So if you go on my website, it'll give you the address, the time. And then after that, I'll be doing a Midwest tour where I'll be in Fairfield, Iowa, where there's a very large Ayurvedic community and a college there, as well as Chicago and Milwaukee. So I can be there. And then I'll be doing some more East Coast tours as well. But again, everything will be on my website.
Okay. And what's your website again?
Just go to Dr. Marianne Teitelbaum, and it'll come right up.
Okay, that's great. And we're approaching about a minute left. I wanted to thank you so much for being our guest. Good luck with your tour and other books. You're more than welcome to return and discuss them once they become published. I just want to thank you so much for bringing so much diversity to Nightlight.
Oh, thank you. Thank you for having me.
All right. Hey,